This is the Valley's original morning magazine show, Sonoran Living Live on ABC 15.
All right, well, take along a lunch and come back looking fit and trim. Your friends will be asking you, what the heck did you do? How the lunchtime lipo works next. Plus, how'd you like to slim down and trim those really hard to reduce areas in just an hour? Maybe lunch. Lunchtime lipo. It is the latest approach that is getting quite a bit of attention right now, mainly because of the immediate results. So we've invited Dr. Todd Milan, the leader of Smart Lipo, into our show, and you brought with you Sherry Hoffman, who is a patient of yours, and she has had the procedure done a couple of months ago. So welcome to both of you.
Thank you, Stephanie.
We appreciate you coming in.
Thank you.
I was joking with him early on, and I said, so, you know, with what you do for a living, do you kind of look people up and down and go, yes, you're definitely going to benefit from this? And he said he doesn't. But let's go ahead, and all kidding aside, talk a little bit about, people get really nervous when you start to talk about liposuction. You must admit.
Yes, Stephanie, I can understand it. It is a concern, especially in regards to some of the recent information that's come out about traditional or standard liposuction. One of the reasons that I perform the Smart Lipo procedure is the degree of safety is vastly improved from regular or traditional liposuction. Regular or traditional liposuction uses a large cannula like this, and this cannula is very traumatic to the tissue. And because it's so traumatic, it usually requires a general anesthesia or a deep IV sedation. The Smart Lipo procedure uses this very small cannula with a laser, and that small cannula with a laser, and this is about the size of an angel hair pasta.
Thinner even. Yeah.
Very thin.
Very thin. I don't even know if you can see that on TV. It's so thin.
It's very, very thin. Pinpoint. So this little pinpoint incision and the laser being far less traumatic to the tissue means that we do not need to do a general anesthetic. We do not need to do IV sedation. We can do this procedure entirely under local, and that's the greatest risk when it comes to a liposuction procedure, is the anesthetic involved.
That's what's causing people to lose their life in some cases?
That's the cases that we've seen. That's the majority of the problem is associated with this.
That's very interesting.
This procedure has been used worldwide for the last 8 years, and there has never been a major complication associated with the Smart Lipo procedure.
What are the additional benefits of using, say, the laser type of lipo as opposed to the traditional?
Well, with traditional liposuction, you rip or tear the fat cells out, so you can end up with irregularities in the tissue.
The bumpiness.
The bumpiness, the waviness, the irregularities are a normal part of regular liposuction. With the Smart Lipo procedure, you actually melt the fat cells, so it's a nice, even melting pattern. And in addition, it tightens your skin.
So you're not going to see the excess skin that might hang, which you often get when you have rapid weight loss.
Correct. It actually corrects the sagginess that you would normally attribute to normal liposuction, so that the patients who have this procedure done, they not only have a smoother result, but they have tightened skin, so it's a very natural appearance. It does not look like they had liposuction done.
Okay, well, I want to get over to your patient. Sherry, go ahead and tell me a little bit about why you decided to get lipo.
Well, I've never had a flat stomach, and I work out all the time, and it just was something that I could never achieve. So I was actually going to get traditional liposuction, being put under, and that was my biggest fear. And then I saw Dr. Milan on TV, on the news, and the next day I called, made an appointment, canceled my traditional liposuction appointment, and went with him, and have been thrilled.
I want to show a little bit of the video that I believe we have that shows you actually performing the procedure. But before we get to that, let's go ahead and show you some before and after pictures. I don't believe they're of you, Sherry, no?
No.
But they are still showing pretty dramatic results. And this is like in an hour?
This is in an hour.
Really?
And sometimes even less. It's a very quick procedure that you can get just incredible results.
Okay, let's go to the next picture, because I just want to kind of, oh, you definitely can see the difference in the, yeah, you can definitely see the difference. We'll just leave it at that. Let's go to the next one, too. What are we seeing here?
Someone who had their lateral thighs done, or the saddlebag area. And the goal is to contour to get a better appearance in the saddlebags, so that you have a normal contour, especially in things such as bikini or swimwear.
Well, who's a prime candidate for this? Are there some people that would not be, it would be advisable?
Well, it's not a weight loss procedure. It's not designed for somebody whose purpose is to lose weight. It's really designed to help contour the body, to give you a little bit better shape and a little bit better appearance, and with really no downtime. I mean, patients return back to work the next day.
So have you combined this with also kind of an exercise and kind of overall
I've always exercised, so that wasn't an issue for me. It was just a specific area of my stomach that I could not get rid of. And so now, when I got off the table, I looked down and I couldn't believe the results. It was...
Was it painful?
No.
No. Uncomfortable?
Maybe a little, but really,
not really.
not bad. And the next day I was up doing my normal routine, went and got a pedicure, and...
Is that your normal routine? I want your normal routine, heck.
So it wasn't bad at all. It was
You know
good.
I'm kidding with you, Sherry. All right. Well, thank you so much for coming on. We appreciate you kind of talking about the differences, because I frankly wasn't aware that this was even out there.
Fantastic.
And I didn't realize that those were the complications with the traditional lipo. So
Right.
I learned something new.
Well, thanks, Stephanie.
And I hope our viewers did too. All right.